Ramsay, what would you recommend to an adult which is late diagnosed? What would be the first steps?
The very first step is just making sure of the diagnosis and getting a good diagnostic evaluation, because a fair number of people may think they have ADHD, but it turns out to be something else. But once that's been established, I think one step is getting educated, doing some reading of some books, getting involved with a local support group or support group chapter can be a good source of information. There's some good online materials. And then thinking through or consulting with a professional about what would be the right treatment. That might be a single treatment, such as medication. It might be an assembly of different treatments, such as medication, psychosocial treatment, support groups. So really looking for what's the best fit for you.
What is your opinion about ADHD psychotherapy or coaching?
Psychotherapy and coaching, the psychotherapy, or more specifically probably the cognitive behavioral therapy, after medications, it's the treatment that has the strongest research support. There's more that needs to be done, and we and other groups are refining the cognitive behavioral therapy model, but it very much focuses on dealing with the impairments of ADHD, how it affects day-to-day life, and looking at improving that. And ADHD coaching is also something where there's starting to be more research, and it's still an emerging field, but it also helps with making changes in day-to-day life. And it can be particularly helpful for university students with ADHD who are in the middle of classes, which are a big challenge to organization and the executive functions. So working with a trained ADHD coach can be very helpful for that group.
Thank you very much.